And welcome to everyone who is on time. Looking forward to another great session with Dr. Robert Baritz. He's going to talk a little bit about practice management here for one moment, and then we'll get on to tonight's subject. Dr. Baritz.
Hi, great to be with you tonight. So as I was chatting with Ben a little bit before we got started, our conversation traveled towards, getting new patients. And of course, new patients are the lifeblood of, every practice. And I started thinking about, my challenges getting new patients. And just like you, I have those challenges. I'm reminded of when I first started my chiropractic practice many, many years ago. And of course, I was starving for new patients. And I sat down for one, and my family, they were tired of hearing about it already. But I sat down for lunch with my wife and maybe a couple of friends, and 2 booths over in the restaurant, somebody sat down that had a cervical collar. Well, I stopped eating, walked over, interrupted their dinner, introduced myself, and that became my next new patient. So I got to tell you, I don't do that all the time, but I was motivated enough to do it. And the person I spoke to was very happy that that happened. But now I still have to get out of my comfort zone. And every day I'm looking for a new person. And it might be a person who we already know, but we haven't brought in the conversation up with. Or might be somebody I meet standing in line in Staples or at the airport or any place. And we get into a conversation, and then I just shift the conversation so it gets to nutrition and acupressure. I open up the conversation and I make an offer, whip out my card, invite them to come into the office for a no-charge consult. And additionally, I have a list of patients who I haven't seen for years. And I spend a little time, not every day, but most days, at least a half hour, maybe even longer, just calling them up, saying hello, getting hung up, getting wrong numbers. But eventually I get somebody to go, oh, hi. Yeah, I said, you remember me? I saw you many years ago and I thought I would check in and see how you're doing. And a conversation develops and we switch to some problems they have. And then I offer them a chance to come in for a no-charge consult where we can go over it. And I promise them I'll show them some acupuncture points that they can use at home at no charge. So I'm working most days, I can't say every day, but I'm certainly working most days to help people in my community. And when you take it from a viewpoint of I'm helping people around me, it's a lot easier than taking it from a viewpoint of, well, how can I make money off this other person? Of course, I'm preaching to the choir because you wouldn't be in this crazy business if you weren't dedicated to helping everybody. The only other piece of housekeeping I want to take care of is substance abuse. A question came up about that in our last webinar. And if somebody's interested in that, I want you to go to my website, or to my YouTube channel. Just go to YouTube and search DRBARITZ. When you search that, as it turns out, another person is advertising against me, and you'll find they'll say, do you mean, it'll come up to another name similar to mine. But you just go ahead and click on my name. And then once you get to, then go to my channel. And when you get to my channel, just search webinar. And when you scroll down, you find the Overcoming Addiction webinar. And that covers just about everything I have to say on it. And after you've watched that, when you're working with anybody, if you have any questions, feel free to reach out to me, probably through Ben or any other way. Let's go ahead and get started. COPD. COPD are chronic obstructive pulmonary disease and is inflammatory lung disease which causes obstructive airflow. Difficulty breathing, coughing, mucus production, and wheezing are all symptoms of COPD. There is no known cure for COPD, and lung damage can progress over time. However, many people can manage COPD and achieve good symptom control and quality of life. Because lung damage is progressive and irreversible, protective actions should be taken as part of the person's regular everyday activity. And it's our mission to inform them of what those activities are. Medical treatments, supplemental oxygen, bronchodilators, oral steroids. Surgery is sometimes recommended in severe cases. Natural treatments, regular exercise, breathing exercises, avoiding smoke, avoiding pollen, avoiding airborne pollutants, extreme cleanliness of the work and living environment as much as possible. This can make a big difference. Now, here's an interesting one, harmonicas for health. Playing a harmonica or doing certain harmonic exercises have been shown to improve breathing muscles, improve ability to walk, help expel mucus from the lungs, improve social interactions, improve self-confidence, and it's fun. For more information on the Harmonicas for Health program, go ahead and Google Harmonicas for Health. Now, eating nutritious food and supplementing with high-quality supplements, whole food supplements, is of course very helpful to slowing and preventing damage due to chronic obstructive disease. Research shows that stimulating certain acupuncture points is a safe and effective addition to any COPD treatment regime. It seems like there's no end to what we can help by using these simple acupuncture points. And here's the quick reference guide that I created for you and your patients. You should have already got it from Ben. I'm just going to go through it. Here is the sort of the image of the video. Over here, when the patient clicks on it, it's a hyperlink to the video. And then the next page is the acupuncture point definitions and locations. And the next page is the 3 points that I recommend and are recommended by the acupuncture masters for COPD, which we'll go over in great detail. And here are the wonderful standard process and MediHerb supplements. And again, a beautiful program, beautifully constructed. There's only four supplements, and you could well give 20 supplements for this life-threatening condition or life-changing condition, but only 4 will do the job. And there's a few others, and I'll show you why you might want to consider those. And here are the lifestyle recommendations, which we covered just a few minutes ago. Okay, if you permit me, I want to remind you that my courses are online. So if you know somebody who's struggling to recover from a concussion, who needs help with erections, who's a family member, somebody who has Alzheimer's, and or if they have carpal tunnel syndrome, this is the time for them to get this course. And over here, coming up very soon, how to help your dog be happier. Okay, pneumotrophin PMG, 2 twice a day on an empty stomach. Pneumotrophin PMG supports healthy lung function, usually used in the AM upon awakening and in the PM before bed. Pumicol from MediHerb, 1 3 times a day, contains herbs that are traditionally used in herbal preparations to support the body's normal cough reflex, support the body's natural ability to break up and expel respiratory secretions, support healthy respiratory tract function, and provide antioxidant activity. Now, I said 1 3 times a day. You can take them all at once, but due to the nature of COPD, if possible, you want to take this in divided doses throughout the day. Drenamin, 3 twice a day on an empty stomach. I personally can't think of living without Drenamin personally, and I don't think I could practice without this wonderful adrenal support product. Supports adrenal function, encourages a healthy response to everyday environmental stressors, and supports immune system response function. Maintains energy production, supports a balanced mood. There's nothing like this on the market. Standard Process is the only one that creates a formula like this you have any questions about the formula, why it's so unique, go ahead and talk to Ben or Keith or your standard process rep. Calcium lactate tabs, 2 twice a day. Supports muscle and nerve function, supports normal functions of cells and cell membranes, supports normal blood clotting, supports proper functioning of enzyme systems, supports and helps maintain healthy bone density and remodeling, provides support in the immune system response function. You're talking about COPD, this is the key for COPD, immune system response modulation. Also consider lactic acid yeast wafers, supports lower GI tract function, 2 twice a day. Lactic acid yeast supports a healthy intestinal environment, cleanses and promotes healthy function in the lower GI tract. So COPD is definitely tied up and involved with the immune system. We already know that 60% of the immune system resides within the gut. So people who have gut problems will have worse problems with COPD. So if you have a COPD patient that you're trying to help and they have gut problems, then that's when you add the lactic acid yeast wafers. Cardio Plus, extra support for the heart, 3 twice a day on an empty stomach. Supports healthy functioning of the heart and other muscles. Supports healthy coronary blood flow. Provides ingredients with antioxidant activity. COPD puts a tremendous strain on the human heart, right? The heart and lungs, they're working together. So if the lungs are not functioning properly, the heart has to work harder to pump more blood through the lungs, which are not fully utilizing the blood that's passed through. So that's why right over here supports the healthy functioning of the heart and other muscles, of the heart muscles in particular. That's why this is in the COPD program. So if you have a COPD patient that's had coronary artery disease, that's had a heart attack, that has a stent, that has high blood pressure, that has any cardiovascular issues, then I recommend adding Cardio Plus to their COPD program. Allerco, allergy support, 2 twice a day. Contains herbs that have been traditionally used in herbal preparations to respond normally to occasional seasonal stresses. Maintains skin and immune system health. Assists in maintaining healthy breathing passages and to support normal breathing. Again, we recommend divided doses due to the nature of COPD. Beta food, energy support, 3 twice a day. Beta food contains beets that support digestion and intestinal function. Provides methyl donors to support liver's natural detoxification processes. Contains naturally occurring betaine for liver and cardiovascular health. Supports normal processing of dietary fats. When methylation is going well, the process helps repair your DNA, regulates hormones, produces energy, and protects against cancer, supports detoxification, keeps your immune system healthy, supports the protective coating along your nerves, strengthens the nervous system, and on and on and on. So methylation is the process used by the liver to attach a methyl donor to a toxin to make it available to be detoxified. So it's one of the steps in the detoxification chain. So if your patient, so how do you know if they need it? If your patient has low energy, I'm tired all the time, doc. I'm waking up tired. You know, I start good, but then I die early in the day. If I don't have that cup of coffee, I'm feeling tired. They need beta food to support the COPD program. Thymus PMG, immune support, or what I call immune insurance. 3 twice a day on an empty stomach. Thymus PMG is designed to support healthy thymus function. The thymus is critically important to the immune system, which serves as the body's defense mechanism, providing surveillance and protection against the diverse pathogens, tumors, antigens, and mediators of tissue damage. So if the person has any sign that they need immune support, do they get frequent colds? Are they always kind of coughing? Do they have mucus in their throat? Then this is the product for them. Okay, let's move on to the video where we're going to cover the COPD acupuncture points.
Hello, today I'm going to show you how to locate and activate 3 acupuncture points to help with the symptoms of COPD or any other condition that causes breathing difficulties. COPD, or chronic obstructive pulmonary disease, is an inflammatory lung disease that causes obstruction to airflow. Difficulty breathing, coughing, mucus production, and wheezing are all symptoms of COPD. There is no known cure for COPD, and lung damage can progress over time. Many people can manage COPD and achieve good symptom control and high quality of life. But because lung damage of COPD is progressive and irreversible, the sooner you get it under control, the better. Regular exercise, breathing exercises, harmonica exercises, avoiding smoke, and eating healthy have all been shown to help. Medical treatment like supplemental oxygen, bronchodilators, and oral steroids are often recommended. Surgery is sometimes recommended in severe cases. Research has shown that stimulating certain acupuncture points is a safe and effective addition to your COPD treatment regimen. In this video, I'm going to show you how to locate and activate 3 acupuncture points that have been shown to be effective in improving breathing. It is recommended that you use all 3 points because they work together to give best results. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. The first point I would like to demonstrate is lung 1. Lung 1 is known as the great letting go point, signifying that this point stimulates a healthy release of toxins, waste products, and nervous system tension. Lung 1 is found on the lung meridian. The lung meridian starts right up over here, just under your clavicle. Then it goes up over the shoulder, down the arm, finally coming to an end on the tip of your thumb. The lung meridian has internal connections to your lungs and your trachea. To find lung 1, put your finger in the spot that is in the groove between your chest and your shoulder and just below your collarbone, right about here. Then find the point that is the width of 1 thumb below that, right about here. Push in to find a point that is sensitive, sore, tender, or painful. That is lung 1. Activate lung 1 by rubbing the area quickly 5 times, take a break for a count of 5, and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find and activate lung 1 on your other side. During or shortly after activating lung 1, you might notice a sensation of heat or energy in your hand, arm, shoulder, or lungs. This is normal and therapeutic. It may take several sessions for these sensations to develop. Kidney 3 is the next point recommended to reduce breathing difficulties. Kidney 3 is known as supreme stream. In addition to improving breathing, this amazing point is used to help with dizziness, ED, high blood pressure, and to improve reaction time. Kidney 3 has also been used to help with hearing, frequent urination, asthma, and to strengthen the low back. Kidney 3 is found on the kidney meridian. The kidney meridian starts near the tip of your small toe. It goes under your foot, coming up on the inside of your foot to your ankle bone, where it then loops around and comes up the inside of your leg, then right up the center of your body, finally coming to a rest near the point where your collarbone meets your sternum. Kidney 3 is located on the inside of your ankle. To find kidney 3, locate the tip of your ankle bone, Then go backwards till you come off the bone. You'll be in a little valley between the ankle bone and the Achilles tendon. Push in to find a spot that is sensitive, sore, tender, or painful. That is kidney 3. Activate kidney 3 by rubbing this area quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find and activate kidney 3 on your other leg and repeat. During or shortly after activating kidney 3, you may notice a sensation of heat or energy in your kidneys, bladder, foot, or anywhere else along the course of the kidney meridian. This sensation is called Da Qi and indicates that the treatment is getting deep into your system. It may take several sessions for Da Qi to develop. The third point of this powerful trio is governing vessel 25. Governing vessel 25 is known as white crevice. And in addition to improving breathing, governing vessel 25 has been used for nasal congestion, nosebleed, and headaches. Governing vessel 25 has also been used for nasal polyps and to improve the appearance of alcoholic nose, also known as drinker's nose. The governing vessel is a channel that is said to collect, conserve, and strengthen vital energy. Governing vessel starts between your legs, right in here, then comes right up through the buttocks, through the low back, middle back, neck, up over the center of the head, down over the forehead, nose, and finally coming to rest inside the upper lip. Governing vessel 25 is located on the tip of your nose, right here. Activate this point by rubbing the area quickly 5 times, take a break for a count of 5, and repeat 4 more times. It might look like this. Or if you have a Tei Shin, you can gently stimulate it like this. As with any point in your face, a light touch is best. With the Tei Shin, if you are depressing the spring, you're definitely pushing too hard. The correct pressure would be like this. During or shortly after stimulating governing vessel 25, you may notice a sensation of heat or energy in your face, head, neck, or back. This is normal and therapeutic. It might take a few sessions for these sensations to develop. If you have COPD and you want to improve your breathing, I suggest you activate lung 1, the great letting go point, kidney 3, supreme stream, and governing vessel 25, white crevice, 3 times a day for the next 30 days, and then use these points as needed. And if you know somebody else who wants to improve their breathing or who has COPD, I encourage you to share this video with them. It can't hurt and just might produce a breath of fresh air.
All right. So that brings us to our question and answer session. I did want to interject one thing as you're getting your questions ready. For your next webinar, I would actually like to do one on fasting. You know, today or just this morning, I completed an 8-day water fast. I'm down 15 pounds, lost an inch around my waist, and my blood pressure is down anywhere from 15 to 20 points, depending upon when I take it. So I've been using fasting in my clinic for years, myself, and of course I've been using it in myself in my personal life. So I'm super excited to bring information about this really powerful healing process to you. So if you want that for the next lesson, just say so or put it in the chat box. And what we're going to do is I will then push off the TMJ one to the following week. So with that, I am open for questions. And Ben, if you want to read any questions or comments to me.
Yes, sure. Again, if you have any questions, use the Q&A box at the bottom of the screen. Just click in there and type them in, and we'll answer them. I have a quick question for you. 2 quick questions. So you did an 8-day water fast. Holy smokes.
Yeah.
how did that feel? How did you manage the hunger? At what day did that kind of abate?
You know, I've been doing like 36, 40-hour fasts for quite a while. And that's when I really got over the hunger thing. This is my first longer fast. And I have to tell you, I was not hungry at all during the fast. You know, I would say that something happens that I describe it as my stomach gets kind of lonely. You know, it feels like,
Yeah.
hey, I want to put something, but I'm not really hungry.
Yeah.
And
Huh.
I will say also that it does happen that you have like an urge to eat, and it comes in waves.
Yeah.
And you just kind of ride it out, have some water. And there are a bunch of other tricks, acupuncture points, and certain standard process supplements.
Sure.
And I'll save those as a teaser for our webinar coming up.
Absolutely. Someone said yes to the fasting. And I'll also just say, did you take your supplements through the 8 days?
That's a great question. And I will save that again as a teaser.
All right. Write it down. Okay. So here's a question. Amphiplex. What about Amphiplex and COPD?
Amphiplex is fabulous for COPD. I didn't put it in my protocol. I probably could have. I had to make some choices. I like to keep my protocol short and punchy, but you might have swapped something else out and put Amphiplex in, or you could have simply added it. I think it's just a personal choice.
Sorry. Okay. I was muted there. Any other questions? Throw them. Okay. So let's see. 1, 2, 3, 4. 4 people said yes to fasting. Nobody said no to fasting for the next section. So here's what we're gonna do. We're all gonna start tonight, and we're gonna fast till next week. No, just kidding. Just kidding. But let's see. I don't see any more questions. I guess
Great.
you were extremely thorough and covered all aspects of the COPD. And here's a question for you, but you know, this is a good question for next week. Constance asked, can someone with hypothyroid, can they fast? But I think, again, that kind of fits into next week when you get your
It does. And let me just say this. People on certain medications, it's not safe to do longer fasts. And I will cover that in some depth.
Okay, I do have another question that's come in. This is absolutely true. Many COPD patients are currently on medication. See, people are putting these in the chat box. The chat box moves with every type, so then you lose your space. So please use the Q&A box. But anyway, to finish the question, many COPD patients are on medications. Would you substitute the herbs? I'm guessing the question is, would you substitute out the herbs because of the potential contraindications?
Well, there's two questions. Is possibly they're asked two different ways, Ben. I'm just going to jump in. One, if there's the Medicare lists all the contraindications, you just got to check the contraindications against the Medicare list of the herbs, and then it's either in or out. But what I think the question was, can you take a person off medications or advise a person or help a person come off medications by using herbs? And the answer is yes, but yes, with a precise procedure. And the procedure is very easy. The person continues their meds as directed by their prescribing physician, and you put in the COPD program. As their symptomatic picture improves, you then refer the patient back to the physician. And this is what you tell the patient. Say, look, you don't have to get into all the herbs and stuff you're talking with when you talk to your physician, because they may not understand that. But you just say, tell your physician you've been improving your lifestyle, you're improving your diet, you're maybe taking some supplements, and the symptoms are going down. Does he think that this might be the time to do a trial reduction of some of the medications? almost every physician that I know I've worked with are delighted to do this because they know they're working with a motivated patient who's taking control of their health. But so it's a two-step process. You're really working with the PCP.
Great. Any other questions? Okay. So one person said, this is a hard sell to patients who feel they're already taking so many pills already. Is it? I'm sorry. It's a question. Is this a hard sell to most patients who feel they're already taking so many pills?
Well, it could be. It could be. Then there's a couple of different ways I go about this.
Yes.
First, I say, well, let's just do the acupuncture points. There's no extra pills there, and there's no extra cost there. And then you really separate the wheat from the chaff. Is the patient unwilling to do anything, or is he willing to do something, but he has maybe a little legitimate objection to the supplements? So he's great, I'll do the acupuncture points. And then you take a look at the program. Is it really too big for the patient? So if it's too big, maybe what I do is I do what's called horse trading with my patients. I say, okay, well, let's take this supplement out, which you've been on for 2 years now, and pop this one in. So I horse trade it in. And also in my program, I put the supplements in order of importance. So if you can't get them all in, you start from the top and the way you work down. Or so this is the third option, or if the patient really has a very small program and they could do more, you could simply say, well, look, here's what I recommend. I've listed them in order of importance and you make the choice. So I just throw it over to them. But those are my 3 different answers. Great question. I'm confronted with this, every day, just like you are.
Great. Someone said, can you share the speaking points in the Happy Pet series to come?
Can I share the speaking points? Yeah, I know exactly what you're talking about.
Okay.
Yes, I can. What I'd like to do, those talking points haven't been, I'll probably have them Monday. So Ben, do you want me to send you a link to the talking points and then you could dispense it
All right.
to our team? Does
Yeah,
that
that's
work?
fine.
Yeah. Just make a note of that.
All right. And a couple people chimed in and said anemia is a good topic too.
Oh.
2 different people.
So, good. So how many lessons do we have left here, Ben?
I need to go to my calendar. Let's see, today we've got next week the 3rd, and we've got, that's it.
Next week is the last?
Yeah, it's 10.
Oh my goodness, man, time flew. So I'm going to make a note of that.
7, 8, 9, 10. Yeah.
If the powers that be deem another series, I'll be here, and that'll be on my list.
Great. One last question. How quickly have you seen results with the protocol for the COPD?
People experience initial results within the first 30 days, and that isn't necessarily earth-shaking, but it's enough that the person knows they have it. And the way you determine those results is you have to get a symptom list before you get started with them. Okay, I have trouble taking a deep breath. Great, you write that down. When I go upstairs, when I blah, 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 when I'm doing this, you have to list those in detail, because just like you, when the symptom disappears, the patient forgets about it. They go, I'm not any better. You go, oh, wait a minute. And then you go down the list. Let's see, you were having trouble breathing, we went up like 2 steps. How's it now? Oh, I can get up 4 steps. So that's how you do it. And certainly within 4 weeks, you'll see some initial results. And then it follows the same program that you'll see with many, many nutritional programs. Over the first few months, you see progressive results. And then you hit a flat point where it doesn't seem like they're getting anywhere. And the patient may become discouraged. because they forget how bad they were. And we have to push them through and encourage them through. And then at about month 6 or month 7, they have a breakthrough and they feel much better. Very typical. Some patients are a little different, but it's a very typical scenario.
That's fantastic.
Yeah.
All right. I think that's a wrap. It's almost 10 past. Thank you for the extra time. We'll see everybody next week. Hopefully most of you tomorrow night, and some of you even in person on Saturday with David Hogshead. So busy week for us, and hopefully we're getting all the answers for the many, many, many patients that are coming through your practice, and you're getting them so much better. So we thank you all. Thank you again, Dr. Baritz, and I'll see you all very soon. Bye.